I actually came to this because my son Jacob had medulloblastoma. Giselle was one of the physicians and clinicians we turned to for potential treatments, and along the way learned how to be activists through, frankly, the counsel of Andy McCulloch and Pat Lacey and parents like them. So thank you both all so much for that. When my son Jacob was diagnosed with medulloblastoma, what we soon learned is that there's, as you all know, almost no drug development for pediatric rare diseases. Medulloblastoma protocols have not materially changed in 30 years, notwithstanding now some very new exciting work that's happening. But what we learned is that my son's disease was refractory from the beginning, and what we learned is that there were really no other protocols that we could consider because there really are no alternatives. Beside clofarabine, the FDA has not had initial approval for any pediatric indications in 20 years. So with that and with Jacob's death, I formed Kids vs. Cancer. And I'd like to take a step back and just tell you a little bit about some of the other projects we do in Kids vs. Cancer too, beside the Creating Hope Act. And in telling you about these projects, I'd like to invite all of you to show us how we can help you better, train us up better, give us opportunities to get more involved in some of the problems that you are confronting and that really impede your ability to develop drugs for pediatric cancers. So Kids vs. Cancer is really focused on the drug development process. One area that we are focusing on is, of course, access to federal funding. We're looking at your abilities to get access to drugs to test kids, to treat. The Creating Hope Act, which addresses financial incentives that drug companies and institutes really need to engage in this kind of work. And finally, how the FDA reviews work from pediatric researchers. With respect to access to federal funding, we're looking at the peer review process at the National Institute of Health and the National Cancer Institute. And we're starting to look at ways that we might be able to modify that process so that really it is more meritorious and does not result in what we perceive to be chronic underfunding of pediatric cancer researchers. So we're looking at various alternatives there, using the metrics both of what's the most impactful and what's most politically expedient. Our second project focuses on access to drugs, and it's my understanding that oftentimes it's not easy to access drugs from companies when a new drug on the market may look exciting. There are various pieces of legislation that will be coming up in 2012, and that will be due to be reauthorized at that point. In particular, they're called Best Pharmaceuticals for Children's Act and Pediatric Research Equity Act. And they really go to the issue of relabeling of drugs developed for adult indications so that they may be used better for children's indications. But in the reauthorization of these two pieces of legislation, there will be opportunities to modify these pieces of legislation so that hopefully we will give pediatric researchers the opportunity to get drugs from drug companies before the drugs are approved by the FDA. And my understanding is that some drugs in preclinical stages or phase 1 or 2 may be very exciting to look at for pediatric indications. On the backside, beside clofarabine, or even including clofarabine, it's not easy to get FDA approval for a pediatric drug. And we have started a dialogue with FDA Commissioner Peggy Hamburg on what the FDA can do to better support drug development for pediatric cancer research. And so the question is, what new innovations in regulatory science the FDA can adopt that really will take into account both the new science that you all are focusing on, and also what limitations are inherent in pediatric research. And you know, what I find when I troop around Washington, D.C. is that these issues that all of us think about all the time are completely foreign to members of Congress, to their staff, and even to senior officials at the National Cancer Institute or the federal or the FDA. People just really don't focus on the challenges of pediatric researchers, and I think there's a lot of opportunity to include new thoughts about how to do things in these areas. But what I'm here to really focus on is the Creating Hope Act. So the Creating Hope Act is legislation which was introduced in the Senate in March 17th of this year, and we expect it to be introduced soon in the House. The purpose of the Creating Hope Act is to provide market incentives for drug development. And so if the problem is that it's very difficult to capture return on investment for, say, relapsed neuroblastoma, when it's a market of fewer than 400 kids, then the question is, where are there opportunities for profit, in particular for private sector drug companies who have fiduciary duties to their shareholders. I'm grateful that institutes like the Van Andel Institute are looking at this problem. I think that any and all activity we have from the private sector also helps us all. So the way the Creating Hope Act works is that the Creating Hope Act creates a voucher which the FDA confers upon a sponsor who successfully receives FDA approval for a drug for pediatric cancer or any other pediatric indication. And we have a legal definition of what a pediatric rare disease is that would qualify for a voucher. But any pediatric cancer, and surely any neuroblastoma drug, would qualify for a voucher. The voucher comes with rights. The voucher comes with rights that are transferable, and the rights are that any other drug, for example, a stomach acid drug, would receive what's called priority FDA review instead of standard FDA review. And this would enable this other drug to get to market 4 to 12 months faster. So the way it works at the FDA is there are 2 standards of reviews for drugs that are under review for approval. Under standard review, the review time is regulatorily required now to be 4 months longer than the standard review. In fact, the FDA oftentimes misses its review guidelines, so the delta between the 2 programs can be quite extensive. And priority review also comes with other rights vis-a-vis communication between the sponsor and the FDA. So we are hopeful that by championing this legislation, hopefully passing this legislation, we will create opportunities. For example, if Giselle creates the next new drug for neuroblastoma, that as the FDA approves this drug, the FDA would be able to issue a voucher to the Van Andel Institute, which the Van Andel Institute could sell, for example, to Novartis, which may have a drug for arthritis or some other large market drug. And this other, Novartis, for example, in exercising the voucher, would hopefully receive a faster FDA review and get that drug to market sooner. The valuation of the vouchers is unknown. It's been estimated to be in the hundreds of millions of dollars, and so that really creates the incentive. So that's what the legislation is. The legislation is based on current law that exists to provide vouchers, priority review vouchers for neglected tropical diseases. And you haven't heard about the current legislation for a number of reasons, one of which is it doesn't work. So what I did is I came in, I brought in a leading DC law firm, we rewrote the legislation and fixed it, and we extended it. And politically where we are is we have it introduced in the Senate, it has bipartisan support, it does not require an appropriation, it requires no taxpayer funding. And so for that reason, we believe there's a very good chance that it could pass. It has become the priority of the Pediatric Cancer Caucus on the Hill, which is comprised of 70 members of Congress. And so we're excited and we're working on it. And our goal for passage would be about 18 months from now, when another major vehicle called the Prescription Drug User Fee Act is passed. So that's what we're working on. And I will say to all of you, thank you so much for inviting me here. To the researchers and clinicians here, please use this opportunity to contact me to let me know what else we can do in Washington to address some of the challenges you have in pediatric cancer drug development that could be addressed in a policy forum. Thank you.